All right. Good evening. Thank you so much, everyone, for coming. So I have the pleasure of giving you an update as the global chair. You've had quite a year, you will see. And I would say for research, for Mission Thrombectomy, it's been a watershed year. And as Dr. Eccles just said, we got a publication in Circulation for the first ever estimation of access to thrombectomy. But we really had a lot more that happened. I was fortunate to be invited to be part of this estimation of the economic burden of stroke. This is a group from Brigham and Women's, and who had asked Shashwat Desai, who is one of our superstar CEC members, to participate, and he asked me to join in. And we found, using what is called the value of welfare lost estimation, that the annual burden of stroke is $2 trillion, over $2 trillion globally every year. That's 1.67% of GDP, global GDP. It's just mind-blowing to think that the stroke causes this much loss, and certainly ischemic stroke is the biggest part of it. And the high-income countries actually don't bear, the high-income countries don't really bear the burden. It's the again, the low-income countries. How do I use the, is there a pointer? Oh, here, yeah. Oh, yeah. So the high-income countries in the orange actually are somewhere in the middle. It's North Africa and Middle East. Look at that, how much proportional loss as compared to their own GDP, and sub-Saharan Africa. So again, it's one thing to be a low and middle income country, and then to have the burden of stroke is just crushing to see this. Anyway, we are going to fight this together, as all of you know, and we've made tremendous advances in 2023 together. We had a robust public health intervention implemented in over 30% of regional committees. I'll show you. And these are interventions like public education, EMS education, interventions like building pre-hospital networks where there are not, and of course, stroke center certification. So this occurred in over 1/3 of our 107 regional committees, which you may say is not great, but frankly, this is all volunteers. This is not anybody who is full-time paid. This is all just MD volunteers who, especially in low and middle income countries, have busy practices, who are putting in their volunteer time to develop interventions and implement them. We added several new regional committees. I'll show you. Thrombectomy workshops led by our rising superstars in the CC, Doctors Kaustav Lume, who led the Indonesia workshop, and then Dr. Asif, Kaz Asif, who led the Mexico workshop. And we are very pleased to announce, and Amir already announced it, and you met Dr. Eccles, but we are very excited to welcome Dr. Frederick Eccles. The title is actually he's the Global Program Director. For those of you who don't know, Dr. Eccles is one of the first Obama fellows, and so he is a tremendously distinguished global health professional who is going to bring us, I think, to a next level. So welcome again. Thank you. We were very thrilled to be accepted into this UN ECOSOC Council, which is a council for civil societies. This includes social as well as health initiatives. And so this was a big achievement in August 2023. We were accepted after 1 year of application and processing. And so this allows us to bring our voice to the table for stroke and acute stroke care. We rebranded our name. We were getting far away from 2020, so we all through surveys and inputs decided that we're going to just call ourselves Mission Thrombectomy. So MT 2020 Plus becomes Mission Thrombectomy with a new logo, and I'll show you the logo again. And the website has been fully rebuilt and is highly user-friendly and is ready for 2024. And the MT Ambassadors Program is actually a very exciting initiative for young early career volunteers as well as trainees. We really did not anticipate this kind of growth. October 2020, we had only 29 regional committees. That has increased to 107 regional committees. And so this has been tremendous growth. We added about, I would say, 7 or 8 RCs last year. And the best part is that we are reaching the farthest corners of the world. You can see from this map here, we have covered a lot of areas in Africa, sub-Saharan Africa. We are covering a lot of LATAM, and we are really quite. I mean, just look at these. The covering of the continent. We are very happy. We actually had, just a side note, we had great 3 or 4 meetings with Russia. This is before the war, of course, and that hasn't quite happened. But Russia actually has a very interesting system of thrombectomy. Their thrombectomy is done by vascular interventionalists. So they do head to toe. They do PCI, they do pulmonary embolectomy, they do thrombectomy. So they have a pretty interesting system, but hopefully we'll get them on one of these days. Our regional committees, as I said earlier, they implemented a lot of public health interventions. You can see that in Afghanistan, Bangladesh, Dominican Republic, Ethiopia, Pakistan, there was local management data that was collected. For the first time, plan was developed to get resources. And the kickoff meeting, really, that's one of the things that happens when we form regional committees, is that often first time the peers in the country come together to focus on thrombectomy. And we feel really quite fortunate to facilitate that. In all these countries, we assess the feasibility of thrombectomy systems. We got them connected with the rescue database. I'm not going to get into all the details in the interest of time. And this was also continued very well for in India, Nepal, Indonesia, Philippines, and Mexico. We launched the ambassadors program. If anyone wants to take a picture of the QR code and wants to join as an early career trainee ambassador, you're most welcome to write to us. These ambassadors right now are social media influencers, because as we know, the rise of social media as a outreach and education platform has established itself, and we have these ambassadors get our toolkits to increase the awareness that stroke is treatable and that thrombectomy is a highly effective emergency treatment along with thrombolysis. And that's what the ambassadors are doing at this time. As we get more resources on the administrative side, we're going to have them do more for us. We continue to work with our regional committees for awareness campaign, capacity building, advocacy, research and development in the regional areas, develop more partnerships, and develop a standard and guidelines. And then I'm going to talk about teleobservership in a second, and patient and public education. We had symposiums and education webinars in multiple regional committees: Sri Lanka, Indonesia, Mexico. Sri Lanka was really amazing because this happened right after the economic crisis, but the neurologists there were very keen on partnering with us. So we went there in March of 2023 for a stroke meeting and really talked about thrombectomy and thrombectomy access. And then Bangladesh is about to sign an MOU. The government of Bangladesh is about to sign an MOU with us for training of more neurointerventionalists. This is the Indonesia workshop, and you can see how many people attended the workshop. And so kudos to Dr. Limay. Let's give him a big round of applause. This was a huge effort. And I think you should say something when you come here for the awards, how people react. It's like any of us, we remember when we were trainees and we were hungry. This is the same thing for LMIC interventionalists and stroke neurologists. They really appreciate this opportunity of coming and actually showing them and actually talking to people who are doing thrombectomy every day. This is something that we take for granted, but they really, really appreciate it. This is the workshop that Dr. Asif led in Mexico. And when you do your talk, you might mention a couple of things. This is the Thailand conference, which is not a workshop, but really allowed our speakers and CEC members, Dr. Shashwat and Kay, to talk about the analysis they've done about thrombectomy access in Thailand. I'm going to speed up here. We're continuing to do amazing work in the Caribbean with Dr. Gillian Gordon-Peru and Violisa Inoa, and this has been really first time ever in the Caribbean that this work has been done for thrombolysis and thrombectomy access. All the countries have gotten together. We are, Dr. Gordon-Peru and Violisa are leading papers and publications here. And as I said, I'm going to speed up here. But the big thing I wanted to talk about is research and media recognition. We are very, very proud, as I said earlier, to publish the empty glass study. We are very proud of the name, we have a glass, but it's empty, right? Only 2.79% of the world's population has access to thrombectomy, and of stroke patients, I should say, has access to thrombectomy. And that's truly an empty glass. It needs to be filled. It needs to be full. And that's our mission that continues. And we are really thrilled to be accepted in one of the most highest impact factor journals. The New York Times dedicated 8 paragraphs to Mission Thrombectomy on March 1st, 2023, where they wrote about thrombectomy. And we are really thrilled. Mission Thrombectomy, thanks to Sheila and Mayowa and Valerie Fajan, was a co-author in the Lancet Commission paper, Pragmatic Solutions to Reduce Global Burden of Stroke, World Stroke Organization, Lancet Neurology Commission. This is a very, very, very prestigious publication. We are very thankful and very thrilled to be part of it. The empty access score, we're going to talk about that today, is a huge step forward, in my opinion, because I'm biased. But this is going to give us, for the first time, a semi-quantitative score for any region you want as to how much your access is. Then you can titrate your resources, your policies to the access score. If a region has an access score of 1 out of 15, I'm just making this up, that region needs cardiologists to do thrombectomy. I'll just say this there. Whereas if a region has a score of 10 out of 15, they can have only neurointerventionalists. So I think this is the kind of goal we have in developing the thrombectomy score, apart from resource allocation, apart from planning. And then geomapping, I don't know if, guys, you're going to get a chance to talk about geomapping, but this is a huge manuscript of first time ever mapping India for stroke centers and providing policymakers for the first time the distances that have to be covered by patients to get to stroke centers. Quickly finishing up here, directions for 2024. We are launching the remote thrombectomy tele-observership. I know several of you may have followed us. This has gotten delayed because the thrombectomy platforms, the remote proctorship platforms, are still in a state of a little bit of a flux. One of the companies closed down, but there are 2 other companies that are very active, Proxime and Avail closed down, and Proxime and the company that Stryker works with, I'm blanking on the name, they are both ready to go. And I have the privilege of doing the first tele-observership from my lab. This is not going to be a live, this is not going to be a in-person, but it's going to be in the lab with the benchtop models that I'll be doing from the University of Miami. And this is going to be a start of our tele-observership program. Mission Thrombectomy will be joining the World Health Assembly for the first time as a invitee of the G4 Alliance in Basel, Switzerland. The RCs are now going to add an emergency medicine co-chair to each of their committees. We think this is crucial because without pre-hospital, we really can't get rapid and timely access. We're recommending a rotation of 30% of the RC members because a lot of our RCs are now more than 3, and some of them are 4 years old. So we would like to rotate the volunteers. We are doing an advocacy webinar with Dr. Patrice Lindsay from Canada, who's an advocacy expert, so that we all learn how to advocate for thrombectomy access. The core executive committee will initiate work with RCs to develop national stroke thrombectomy plans, and we may obviously collaborate on this with WSO and others. And really, this is crucial, we think, to have a written national stroke plan. And then World Thrombectomy Day, May 15th, we will have global events as always, and we're going to ask each of the RCs, those of you who are online, we really need you to do local events to raise awareness, and we'll be doing online events. And I'll put in a plug for 2025. We could even partner with WSO and do the 10th anniversary, the decade of completion of thrombectomy becoming standard of care. So May 15, 2025, we'll be planning for a big event, hopefully in person if we get the sponsorships. Big announcement, I'm going to transition off as of May 15th as the global co-chair, and Dr. Fawaz Al-Mufti will take over as global co-chair. So big round of applause. I want to thank Dr. Santi Ortega, who has been the vice chair and really has allowed me to feel very stable all throughout. I could ask him anytime at 12 in midnight or anytime about any of the advice I needed, and he has been a rock for me as a vice chair. He's a president-elect of SVIN, so congratulations. And he's going to transition off, and Dr. Kaz Asif, our superstar, first author of the circulation paper, will be taking over as vice chair. So a couple of leadership announcements, and I think I'm going to stop there. We cannot do this without all of you and without all of the partners. Industry, WSO, Angels, AHA, we are here because of AHA's generosity. The G4 Alliance, which is a surgical alliance, obstetrics, trauma, surgery, anesthesia. It's led by a neurosurgeon at this time, and she, Gail Russo, is really a big fan of Mission Thrombectomy within knowing us in the first few months. So she's cheering for us. She's really supporting us, and many other partners that are allowing us to carry on our mission. And I will stop there. Thank you so much.